Shri Dr. Sudhir Visha, a renowned neurologist. Welcome to this session, ma'am and sir. So we will start with Dr. Ramya Mohan to understand the current status of stroke care policies and the infrastructure.
So since I have been mainly associated with Gujarat, and currently I am in the health department for more than 3 years as the mission director of National Health Mission as well as the Secretary of Health here. So there is a very sort of major shift from communicable diseases to non-communicable diseases now. Definitely that is because of the change in the generation, the change in the lifestyle. We all know that maybe in parents and grandparents days, uh, maybe because people were not diagnosing it or whatever may be the reason, but we do hear more about cardiac issues, hypertension, diabetes, which is also a contributory factor, other comorbidities. And also connected to this, you have your kidney disease and other things which naturally arise as a result of chronic diabetes and hypertension. Now, in terms of policy from the government of India side itself, now there is a huge focus on non-communicable diseases or NCD. So we have a complete division, a vertical, and starting from not just dealing with stroke and management of stroke per se, that would be like a very technical, based on only curative and management aspect, surgery and so on and so forth, but also the preventive aspect. So in the recent times, under the non-communicable disease vertical, the government of India has really promoted the concept of a health and wellness center that is below the primary health center. So the health and wellness center, as the name itself indicates, we call it now the Ayushman Arogya Mandirs or AAMs, which is there across the country. So it is, the earlier sub-center level kind of a setup, but we have a new cadre there called a community health officer. So even at the village level, there is a lot of effort which is being made by the government in terms of information, education, linkage with the community, and also not just awareness, yoga, talking about eat right and all these things which are contributory factors, and as well as the curative aspect, even medicines, basic simple medicines for hypertension, diabetes are made available at the health and wellness center itself. So people do not have to travel, till the district or, bigger centers just to get their, prescription medications. So there is a huge shift. And this is like at the primary level. The same way you have NCD clinics in the district level, the sub-district level, the medical college hospital level. And also there is a rising number of seats in your cardiology, in cardiac surgery, and all these things. So which all indicates that the government has recognized that this is something which really needs to be, focused on. And talking about insurance framework, even the Prime Minister's Jan Arogya Yojana, PMJY, has got a very substantial packages for cardiac care and related management, medical management, which means that even the poorest of the poor in our country, through this particular scheme, can avail of these services in the even in a super specialty private hospital which is empaneled with PMJY.
Add on to this, ma'am, can you tell us how can advocacy efforts can help in raising awareness at the community level?
Yes, so for example, when we really needed to talk about polio, we needed to talk about TB. Everybody would know about the 2-drop polio vaccine, the polio Sunday. So we have all grown up with this. So it is that kind of a level of awareness which we need to actually drive, or also the not just stroke per se, but anything which leads to stroke, because stroke is something which is a sort of the end of a spectrum where you can end up being paralyzed, you can be end up being needing management throughout your life. So all these preventive aspects, maybe just regular checking of your blood pressure. So there is a in NCD there is a whole continuum which they have set up where at least regularly couple of times a year people come and at least they get their BP checked, even through the local community health worker. So at least you can detect these things earlier on, and then you can, arrest this the number of people who become dependent on tertiary care. And of course, breadwinner going into tertiary care or any kind of terminal illness, which means that, that's actually the crumbling of many families happen due to that. So the out of pocket expenditure, and of course all the other mental and social, trauma and things which people undergo, that aside, even financially it is a huge burden on the country and also on the citizens. So it is through this community health officer and the health and wellness center, because it serves a very small population. So at that level, there is a huge scope for, sort of rapport building with the community, because mostly the ASHA worker and the CHO, they are all from that area only. So they would understand the people culturally, they would be able to engage with them better, they would be able to understand their own biases and, whatever are the limiting factors of that community, and they would be able to act accordingly. Along with that, of course, it will help if there are NGOs, other organizations, and, even the academic the side, our own doctors, various other medical professionals, even people who are in Ayush. For example, we talk about, the yoga and the various other aspects of, dealing with these things. So it's a complementarity actually. So we do not see this as, something either this or that. So anything which improves your lifestyle, keeps all your parameters in check, keeps you healthy, all these things would ultimately contribute to reduction in stroke and, the fallout of a stroke for the society and for a country, or a country as a whole.
Absolutely. So if we are talking about the, stroke care, and then the rehabilitation is important, the accessibility of it is important. What do you think? What are the challenges in giving this accessibility to the patients of stroke?
Challenges, first of all, suppose after the person is unfortunately, has an attack of stroke, then they do need continuous care. So one major challenge is having a trained pool of healthcare workers who are actually, willing to do this kind of work. So this also, it can be dovetailed with our, palliative and to an extent geriatric policy. It's just a partial overlap, because whether you are terminally ill due to cancer and dependent, or whether it is due to stroke or any other connected disease where you really need 24/7 help, you need even if you have a caregiver, the caregiver also would need assistance to, look after your needs day in and day out. So that kind of a pool, through our nursing colleges, through our paramedical, short term training course system. So of course the nursing council, the other council would also come into the picture at that time. So more and more such courses coming up, authorized and recognized courses throughout the country. This would help us develop a sort of available pool, because the demand is very high. But we all know that we do not really have that kind of a supply in this sector. So that is something which people would need. Another aspect is just like we have in other countries, in India, like a home where you are an inmate. This is a sort of a place where, you are an owner of a unit, and you get add-on services like your medical checkup, on-call doctor, basic, support services for a cost. So these are things which really need to be done. And another thing is, of course, maintaining, the continuous follow up. We see many cases where people are, they come, they have their treatment, and then they drop out. They say, no, no, now I'm fine. So this kind of, awareness, that health seeking behavior, especially among people, and also if you see women as a group, they are less prone to health seeking behavior. They would always consider, "Nay, I mean, I would be the last in a traditional family, typically." So these are things which, the whole family has to be made aware that you need to really, sort of push your, female members, especially the senior ones, to go and many cases you see, cases of breast cancer, etc., coming out into the open in the last stage. If the initial stages, even middle stages, if it had been found out, possibly the lives could have been saved. So the same thing goes for, people don't check their pressure. People say, no, no, I'm fine. I have no symptoms. And the whole funda that it's a silent killer, you don't know that you are actually, about to rupture inside. So these things, through possible concerted ad campaign, government can of course do it, but then, more interesting sort of, quickies and social media, handles by other organizations, by, even organizations not connected to health. If they could do something like this and collaborate with the government on some sort of a loose platform, I think we can really, among the youth especially, we can generate a lot of awareness, and in society as general.
Definitely. Collaboration between the policy makers and the patient, advocacy group, patient organization groups can be effective.
Yes, absolutely.
Infrastructure in stroke care is definitely essential and crucial to give more of accessibility to the patients of stroke. How the government is supporting that?
In government, as you know, the number of medical colleges are increasing by leaps and bounds. Number of cath labs are increasing by leaps and bounds. And because of the PMJY scheme, a lot of private hospitals, even the big, corporate chains, most of them are empaneled into PMJY. You would see nowadays, in if you go to a place like Ahmedabad, in any of the corporate hospitals, the poorest people from different parts of the state are availing treatment there. So it's not just about increasing this, setup in government. Of course, government would increase the seats, they would increase the beds. This is like it's a stage-wise process. So, but it's going on at a very fast pace in India right now. The number of medical colleges have increased like, triple fold over the last few years. So that definitely is important, because then you have to give, more doctors who can service. If you cannot just set up an infrastructure and there is no cardiologist to run it, so that cycle continues, and government has been very much on board for a long time, and that is going on right now. And of course, due to PMJY, the even people who want to take only treatment in private, but they are eligible, they are able to avail of the treatment in private hospitals as well.
Next question to you is, ma'am. What do you think how the patient organization groups can effectively contribute in, raising awareness about stroke at community as well as on a larger scale?
I think they can engage, if there are groups, they can engage with, other groups who are connected with the same. Like you have your medical associations, you have your doctors associations, and you have your senior citizens associations. They have these things at the state level, at the national level, at the district level. You have organizations like the Red Cross, who are very much, into health connected activities, and you would find many such, some of them are very strong, maybe regionally, locally, but they may not have a presence at the state level. So it is these kind of informal and semi-formal linkages which would help us. For example, if there is just a senior citizens group which is very active in a district, if you just link up with them, you would at a single, in a single go, you would be connecting with so many hundreds of senior citizens. So that kind of all the existing social and community organizations, the clubs, your Rotary or anything else, can be utilized. So these interlinkages, and somebody actually stepping up and talking about these things. And of course, social media and these kind of things are like, those are like carpet bombing. We don't know whether we have reached the target audience or not, but then nevertheless, it does have a very huge impact, especially on the younger and middle age generation now. So it's these kind of efforts which I think will help a lot. Organizing few seminars, or maybe even some webinars, or going into, when they are gathering for something which is very like, important for them, have this as a part of the agenda, have a little discussion about it, invite an expert, right? And maybe invite some of the cardiac surgeons or the cardiologists to, have a talk, give some, advice. So sometimes there are very little things which people don't realize. They don't know how to recognize, an issue, when I should actually see a doctor. People keep postponing these things. Encourage regular medical checkups at least once a year, or depending on your age and, other comorbidities. So these basic protocols, if everybody does, because beyond a point, everyone has to help themselves. We can create awareness, we can say, but then if I know everything and I still don't do anything, then that is my problem. uh, this whole aspect that, if you ignore it, it's going to be fatal. That kind of maybe even an ad campaign, if somebody could, visualize, which is more entertaining and sort of eye catching, rather than just being a, very boring statement of facts kind of a thing. Maybe that would also catch attention. You can get in youth groups also on board, so that they also link up, because one youth would be linked with so many other people, at least 4, 5 family members, another 5, 10 friends. So that also would, so anything would help us spread the word.
Before we conclude this session, ma'am, what message would you like to give to the people about stroke and what they should do and what they should not?
Basically, I think the most important thing would be prevention. So just, people should not take it lightly, because the numbers of stroke cases are increasing year by year. And the kind of, stress levels which we live in these days, the kind of pressures at work and family, all these things will be there. But then at least we need to regularly keep checking our BP, start medication as soon as possible, not hesitate to consult a doctor, never postpone or procrastinate about these things. We can postpone any other thing, but we should not postpone, visiting the doctor, and also not dropping off the, bandwagon of treatment, because many people say that, no, this doctor prescribed this, so I felt it was too much, so I reduced it. So all this self-treatment, self-medication, trying to, you know, take over the counter treatment, or just say no. I'll just, you live in denial. Many times that also happens. We know that during the COVID days, we found so many cases of undiagnosed hypertension. Person who has lived their whole life, they never even knew that they had hypertension, but then it flared up because of the whole COVID scenario. So this kind of thing should not happen. And also, if you are in the, uh, I mean, uh, uh, in your family setup, have the same awareness in all your family members, your full circle. If you are a part of any organization, any company, any department, any club, so spread this word there also. And remember that ultimately health is wealth.
Thank you so much, ma'am, for joining us and giving us so valuable insights. Moving on to you, Dr. Sudesha, we would like to understand, what stroke is, what are their symptoms, what are some early signs that people should look for to identify stroke?
Stroke is a medical emergency. Its literal meaning is being stricken off with something. And in neurological language, in medical language, we define stroke as a sudden onset of focal neurological deficit. Focal meaning on one side or the other side of motor or sensory deficit, which is of vascular origin. So, like hemiparesis or hemisensory loss or hemifield defect of vision or speech defect, which is of vascular cause. That is called stroke.
Thank you for sharing so valuable insights, sir. Definitely, being fast can help save many lives.
As I said, stroke is of vascular origin. Some blood vessel territory is affected either due to thrombosis or due to hemorrhage, or there is a clot coming from the system somewhere, like from heart or some great arteries going to the brain. So depending on which territory or which artery is blocked, you have symptoms. So in general, either there is a hemiparesis on one side, right side, or left side, or there is loss of sensation on one of the sides, or sometimes all four sides. There is weakness foresight there is sensory loss, or there is a sudden dizziness, giddiness, there could be fall, temporary unconsciousness, there is loss of vision in one eye, or loss of field of vision in both eyes, like patient can't see things coming from the right side or from the left side on both eyes, or there is double vision called diplopia. Equally, there could be something related to speech and language. Patient cannot understand or cannot speak properly. He has confusion, difficulty in communicating. So that is also depending on which artery is involved. So uh, there are lots of balance problem, vomiting, vertigo. So there is a good mnemonics to remember, and that is called be fast. If you are in the vicinity of a patient who has any of the following symptoms, which are most important, called BEFAS, that is, B is for balance. Patient cannot maintain balance of sways on one side or falls on one side. E is eye, any of the eye symptoms, as I mentioned, either loss of vision, double vision, loss of field of vision. B, F is facial drooping on one side, so there is a sagging of the face on side or some facial asymmetry, or there is arm swing, like if you ask the patient to raise your both hands and then one of the hands falls down, or when you ask to raise on upside, then there is one side which sways and drifts on one side, so that is suggestive of early hemiparesis. Or similarly, uh, S is speech, as I mentioned, speech related problems. So balance, eye problems, visual problems, facial drooping, arm or legs uh, drifting on one side or weakness, and then S is speed disturbance. That is called B fast. Then T is time, meaning thereby time is brain. Don't waste a single second. Rush this patient directly to the hospital by fastest route like 108, or even in the car if that is comfortable to the patient, and reach to the hospital, preferably in ambulance, otherwise earliest possible way. Can save somebody's life if you are in vicinity of such a patient and suddenly any of these symptoms comes up, you must immediately notify the hospital and take the patient to the hospital. Of course, there are some other symptoms also, like what vomiting, vertigo, fall, unconsciousness of unknown origin. This could be also stroke and confusion, etc. But I think the commonest one I have mentioned is mnemonics.
My next question is around the stroke risk factors and its management. Who are more likely in terms of gender and the age group to be at a higher risk of getting stroke? And can lifestyle changes help in preventing the stroke?
It's a very big essay, you ask me. Like there are lots of risk factors we should understand. What is the risk factor? The conditions, preconditions that predispose somebody to the possibility of a stroke. And in fact, stroke is a very loose term. We should give the name brain attack. Like heart attack, it signifies the seriousness. We should call it brain attack. Whatsoever, if we call it brain attack or a stroke, uh, there are lots of risk factors like hypertension, smoking, excessive alcohol, then high lipids, that is cholesterol, particularly LDL cholesterol, diabetes, then sedentary lifestyle, stress, lack of exercise, certain familial factors, obesity, that is X syndrome, central obesity with X syndrome X, what we call as, and previous stroke, previous TIA, previous bipolar infarction, heart attack, all these predispose the man to high chances of stroke in future. Now, there are not really much gender differences nowadays. Previously, we used to observe that strokes are more common in males, but now due to change in lifestyle, diet, and that women are also in the stress and they also have habits, bad habits also. So there is not really a very much protective genetic factor. But generally, you can say that before the menopause, females have lesser chances of stroke than males because of protective estrogen. And otherwise, those who have vices and those all who have blood pressure, sugar, irrespective of gender, they all have equal chances of stroke. Regarding the age, we used to see more strokes in the age of 50 plus, 50, 60, 65, 70. And there were chances of young stroke, which was proportionately much lower, like between 25 to 50 or so. But nowadays, somehow, due to increased pollution, increased lifestyle changes, sudden transition from uh, rural to urban area, increasing stress, the higher chances of smoking and irregular lifestyle, and whatever other factors. So that has affected younger generation also nowadays. So it's not that young are as much as old. Still, it is much less than older populations. But unfortunately, more and more young generation people are getting brain attacks, which is also the case with heart attacks also. So that is the irony. Particularly stress, change in lifestyle, pollution, even the infections we are seeing after a lot of uh, infections are also responsible for stroke. So things are increasing in younger generation.
As we are talking about the lifestyle changes, what are the lifestyle changes that are effective in lowering the chances of stroke?
Absolutely right. And this is what would be the most important message of today's discussion. You see, about 70 to 80% of the strokes are completely preventable. I would explain this in little length. You'll be surprised to know that 40% of brain attacks, that is strokes, and 40% of heart attacks are just related to high blood pressure. If we simply control blood pressure and monitor throughout the rest of the life and control it properly, the chances of stroke becomes very less. In other words, one if one has hypertension, blood pressure, then for him or her getting stroke would be 2 to 4 times higher than normal population. So that such is the massive impact of blood pressure. So how do you reduce that? By regular checking, taking proper medicines and titrating them, reducing salt in the diet. If you don't put extra salt and don't use mirchi, adhana, papad, etc. in this diet, I think you reduce your blood pressure by 10 millimeter. Like in Canada, I'm told there are no common salt bottles in the restaurants. So by law, it has been removed. So something has to be done to educate our younger population not to use all these extra salt things. Next is the cholesterol. Uh, Reduce dairy foods and a lot of butter and oil and other items. So that would also reduce cholesterol. It is also a very important risk factor. Similarly, smoking. Smoking in any form, or tobacco, or cigars, or masala, gutka, all these are very, very serious causes of stroke and heart attack, both, and cancer, of course. So it's like this. If you smoke a one berry, you reduce your lifespan by 5 minutes. And if you leave smoking at the age of 20, as for example, tobacco or smoking, then you increase your lifespan by 9 big years. So this is the mathematics of tobacco and smoking. I hope you understand how serious the impact of tobacco and smoking is to health. Similarly, diabetes control helps also a long way. Those who do regular exercise and cut down their central obesity, they also have very lesser risk of stroke. Those who don't fall prey to drugs, nasty drugs, people are using more and more abuse drugs, including cocaine, heroin, and that has been a fashion these days. Very sad and unfortunate. So that is also one of the important causes of stroke and heart attack. So why I'm telling heart attack and stroke together? Because most of the risk factors are common for stroke and heart attack. So if you prevent this, another thing is automatically prevented. So then reducing stress, doing relaxation techniques, meditation, yoga, pranayam, and how to enjoy life, that is also very important. In this competitive phase of life where people have migration from distal places to mega cities, and then they have to fall prey to lots of running around and time bound things. So I think one should be very careful and adjust the lifestyle accordingly. Same way, uh, early rising, early to bed, doing exercise and yoga and relaxation techniques, all these things help, and not using a lot of social media. Instead of that, reading good books, life improving series things, and doing music or some reading of positive material would help instead. So, and then one should stay away from polluted areas if possible. uh, you should be immunologically fit so that you don't acquire infection. That is also important. And you must get your body regularly checked for body profile and find out whether you have a sudden coming up of blood pressure, diabetes, cholesterol, thyroid, or some liver, kidney disease, or some unfortunate thing. So unless you do regular checking, you will not know. So if I reiterate, by simply reducing blood pressure to normal, diabetes to be checked and controlled, proper control of cholesterol, not using alcohol, smoking, and drugs, and doing exercise, yoga, relaxation, living stress-free life, and avoiding sedentary lifestyle and using less of social media and remaining away from pollution. These factors, which are simple to implement, can reduce stroke risk by 70 to 80%. Rest of the factors like atrial fibrillation and past strokes and certain are non-modifiable, but still, whatever you can modify, one should do that.
As we conclude this session, so you shared an example of Canada. What role do you think community education plays in preventing and spreading awareness about stroke?
Well, it is very fortunate that for last decade and half, governments are working very much hard, and also in company of NGOs and also organizations like our national body, Indian Academy of Neurology, and similar bodies. So there are a lot of changes now. Simple example is that we are able to do thrombolysis program in our government hospital setup, which was never a case before. So by mass education from time to time in media, in newspaper, printed, in electronic media, and public seminars, if government also increases this, it's already done, but we can increase And doctors should also participate in educating people at large. Masses should be educated, not to take drugs, but to prevent the disease, and that is first and foremost thing. Second thing is rehab measures. If we can increase rehab measures right from motor deficit to cognitive deficit like memory and other things, or psychological impact, or vocational rehab, and a lot of other impact. The stroke produces multiple domain deficits. So in rehab, we have to do a lot of things that is also possible. And detection of blood pressure, diabetes, cholesterol, thyroid, uh, cardiac abnormalities, and other diseases by door-to-door survey, which I think is lacking in our country. So we should encourage government public partnership or NGO government partnership and do mass screening and multiple time checking of all these diseases so that silent killers like blood pressure, diabetes, and cholesterol are controlled, detected and controlled, and then they are followed up regularly to the referral centers. So this is how we can certainly cut down lot of calamities occurring to our. The government cost for stroke is 8,000 crores per year for stroke survivors. Now, that was in 2017. Now it is in 2024, it must have reached to 12,000 crores or so. Every 30 seconds, there is a stroke in India. Every day there are 5,000 stroke in India, and that comes to about one third of them they die, one third of them are permanently disabled, and one third of them are back to the work. So you see, this is not only a loss to that person, but the family member. If he is an earning family member, then you can consider the terrible plight of the family. So it's a loss to family, loss to society also, and loss to nation. So we have to prevent this terrible cause. Stroke is number one leading cause of disability in the world, and number two leading cause of death in the world. So one has to be very aggressive in preventing stroke, identifying risk factor, treating. So the government can help us in all these directions. Our bodies like IAN and others, and individually people like us, and those who are working in municipal and government medical colleges, we are all very much eager to do this for our community. We have done that at several levels by mass education, TV, and newspaper education, etc. And we want to do more and more. I hope people also come forward and join and make stroke clubs or stroke society, etc. And they also start educating other survivors and other people also.
Thank you for sharing so valuable insights, sir. What message would you like to give to the people about stroke?
Yeah, I hope it will awaken the masses and help reduce stroke incidents to some extent, and more awareness comes, and people come forward and take care of their blood pressure, diabetes, cholesterol, and do exercise and reduce their stress level. This would help. And no tobacco, no alcohol, no drugs, certainly. And regular checking of their body, apart from doing regular reading and music and other activities. And I tell you one thing, at last, the control of the senses and control of our ego, anger, jealousy, etc., also has a long impact on prevention of stroke and heart disease. These kind of negative feelings we have seen in our practice for 35 years that they also impact adversely. So they are the important cause. That should be also be curtailed. So thank you very much and good luck for all this endeavor. I must appreciate the endeavor from your end, which would help our people. Thank you very much. Thank you so much.
Thank you so much, Dr. Ramya and Dr. Sudhir, for joining us and giving us so valuable insights about stroke, its preventive measures. Thank you for joining us.